Hello colleagues, I just want to take a moment to talk a little bit about the cerebellum. So if we were to simplify this complex region of the brain, we could say that the cerebellum has the purpose of helping you do things better and faster. And when it comes to the vestibulocerebellum, its primary job is to allow you to have good balance, yes, coordination of movement, coordination of eye movements, but especially the muscles of the body related to gait. And so when we look at gait, we look at posture, we look at muscle tone, kind of make some notes and see, is it more likely to be a right or a left cerebellar involvement? And so if I look at eye movements and I see that they're not smooth, especially pursuits, then I'm starting to think, okay, maybe it's involved. When it comes to saccades, are they dysmetric? And again, that's another clue. And so when you start piecing those things together, if everything seems to present on one side, we want to do some things to build some efficiency and some endurance in that aspect of the brain. And one of my favorite ones is there's really two parts to it. One of my favorite ones is on the Focus Builder app, where I would do a touch saccade. And so where we have to touch the target on time, and I'm doing a terrible example of it right now, but when it's on time, it'll light up in green. If it's early, it'll light up in yellow. If it's late, it'll light up in red. Now, for the right cerebellum, what I would do is I would touch the target moving up and to the right, and then I would follow the pursuing target back down and to the left. But before I do that, I want to do something to prime the cerebellum. And so with patients that are more delicate, you might need to start with more of a passive kind of motion where you're doing complex movement. But eventually you want to work your way up to an active movement, and especially an active movement with resistance. And that's how we want to think about our patients, is we want to constantly increase the intensity level of their activity and their therapeutic exercises. And this is really one of my favorites. So a lot of times what we'll do is we'll have patients use the arm bike, and so this would be the right arm for the right cerebellum. And in some cases I may even have them do this for 30 seconds with one arm, and then both arms for 30 seconds. And they'll keep alternating every 30 seconds, so that way they're not over fatiguing that one side. And of course, if they get stronger and better, then they could actually do one side only for the predetermined duration. After we do this exercise, then we go and do the Focus Builder. In the preset exercise, it's actually called, it would be right hand, left brain. Or if it's for the other side, it would be left hand, right brain. So I hope you find that a little bit helpful. You might want to start looking for an arm bike. I use this thing all day long, every day, and I found it to be extremely effective. Have a great day.